Hello, and welcome to our virtual library series from Shared Health, Mental Health, and Addictions. This presentation is called Fundamentals of Addiction. Before we begin, it's important to note that Shared Health provides health services in facilities located on the treaty territories and ancestral lands of the Inuit, Anishinabeg, Anishinaabe, Nahetawook, Ininawak, Nehiawak, Dakota Oyate, and Denesuline nations, and on the national homeland of the Red River Métis. We acknowledge harms caused by colonialism and dedicate ourselves to building relationships and collaborating with First Nations, Inuit, and Métis people. Through this commitment, and rooted in truth and reconciliation, we will improve health experiences and outcomes for Indigenous people. In this presentation, you will learn about the definition of addiction, how language impacts the way we speak about addiction, why some people may be more at risk for addiction, as well as two important theories: the levels of involvement and stages of change. These two concepts can help people determine the harm of addiction, the stage of motivation to make change, and a potential plan for recovery. It's okay if you're not familiar with these terms, as we will be defining and discussing them in this video. You will learn about the available treatment options, including community-based services, in-house treatment, and mutual aid support groups, including virtual options. Lastly, you will learn about Manitoba resource options, including the Shared Health, Mental Health, and Addictions Library, and the Addictions Helpline. What is addiction? Addiction is a treatable chronic medical disease involving complex interactions among brain circuits, genetics, the environment, and an individual's life experiences. People with addiction use substances or engage in behaviors that become compulsive and often continue despite harmful consequences. Prevention efforts and treatment approaches for addiction are generally as successful as those for other chronic diseases. When using substances, harms to the person can range from mild, such as feeling hungover or being late for work. More severe harms to the person may include loss of housing, disease or chronic illness, injuries while under the influence, trouble thinking clearly, blackouts, problems with relationships, feelings of anxiety, irritability, or depression. This can be increased if someone is already experiencing a mental health concern. The next term we are going to define is co-occurring disorder. The term co-occurring disorder describes when a person has both a mental health challenge and a substance use issue or behavioral addiction, such as gambling, at the same time. An example of a co-occurring disorder would be a person having both an alcohol use disorder and being diagnosed with depression. You may also hear co-occurring disorders called concurrent disorders, comorbid disorders, dual disorders, dual diagnosis. Next, we'll look at some examples of co-occurring relationships. Mental health challenges in combination with a substance use issue or behavioral addiction can impact each other in different ways. According to the Center for Addiction and Mental Health and the Substance Abuse and Mental Health Services Administration, substance use can make mental health issues worse. For example, cocaine use can make you feel more anxious and increase unwanted thoughts. Use of cocaine can also lead to taking more risks. This could result in spending more money than you wanted while gambling. Symptoms of one problem can look like the other. For example, the symptoms of long-term methamphetamine use can look like a mental health symptom called psychosis. Substance use can hide the symptoms of a mental health issue. For example, alcohol use can hide social anxiety symptoms. One issue may cause development of the other. For example, the risk of developing psychosis is greater if cannabis use is started at an early age. Additionally, sometimes people use substances to stop thinking about their mental health issues. Some substances can make mental health medications not work as well. Using substances can make people forget to take their medications. To make an informed decision about using substances, it is important to understand the impact they can have on your mental health. When a person receives prompt treatment for co-occurring mental health and substance use problems, there are much greater hopes for recovery. Supporting a family member or friend living with a co-occurring issue can cause feelings of stress, anger, sadness, and worry. These feelings are natural, and many other families and friends feel the same way. As a support person of an individual with a co-occurring disorder, you may need to advocate on behalf of the person. You might need to educate others to help them understand co-occurring disorders. You may have negative feelings sometimes, and that's okay. You need to look after your own emotional, physical, and social needs. Please reach out to family, friends, healthcare professionals, and support groups. Remember that you are a part of a team of supports that includes healthcare professionals, peer supports, friends, and family members. You are not alone. Having a strong support system that provides empathy, understanding, and hope can have a positive impact on the person's long-term recovery. However, stigma can discourage families and individuals from seeking care and support. We will be defining and discussing that next. Stigma is discrimination against an identifiable group of people, a place, or a nation. Stigma about people with substance use disorder might include inaccurate or unfounded thoughts like they are dangerous, incapable of managing treatment, or at fault for their condition. People who use substances face shame and blame that can prevent them from getting help or reaching out for support. That is why it is important to hear from people who have lived experience with substance use and how they can be helped in their own words. There are many risk and protective factors that may contribute to anyone's risk for developing addictions or a co-occurring substance use issue and mental health challenge. We will be discussing the social determinants of health next. It's okay if you are not familiar with these terms yet, we will be discussing them next. Many factors have an influence on health. In addition to our individual genetics and lifestyle choices, where we are born, grow, live, work, and age also have an important influence on our health. Determinants of health are the broad range of personal, social, economic, and environmental factors that determine individual and population health. The main determinants of health include income and social status, employment and working conditions, education and literacy, childhood experiences, physical environments, social supports and coping skills, healthy behaviors, access to health services, biology and genetic endowment, gender, culture, as well as race and racism. Social determinants of health refer to a specific group of social and economic factors within the broader determinants of health. These relate to an individual's place in society, such as income, education, or employment. Experiences of discrimination, racism, and historical trauma are important social determinants of health for certain groups such as Indigenous peoples, LGBTQ, and Black Canadians. The social determinant most significantly impacting health is income and social status. Income impacts all areas of health. For the lowest income earners, any access to additional funds can increase overall health and wellness. People that have both a mental health challenge and a substance use issue have a greater chance of negative impacts on their lives versus having only one issue. Some of these negative impacts include shame, guilt, stigma, more visits to the hospital, violence, experiencing homelessness, and serious infectious diseases. Next, we will be defining and discussing adverse childhood experiences. Adverse childhood experiences, or ACEs, are potentially traumatic events that occur in childhood between the ages of 0 and 17. ACEs may impact a person's mental health or substance use experimentation. Some examples of ACEs include experiencing violence, abuse, or neglect, witnessing violence in the home or community, having a family member attempt or die by suicide. Also included are aspects of the child's environment that can weaken their sense of safety, stability, and bonding, such as growing up in a household with substance use problems, mental health problems, uncertainty because of parent separation, or household members being in jail or prison. Please note that these examples are not a complete list of adverse experiences. Many other traumatic experiences could impact health and well-being, such as not having enough food to eat, experiencing homelessness or unstable housing, or experiencing discrimination. ACEs are linked to chronic health problems, mental illness, substance use problems, and co-occurring disorders in adolescence and adulthood. ACEs can also negatively impact education, job opportunities, and earning potential. However, ACEs can be prevented, creating and sustaining safe, stable, nurturing relationships, addressing systemic barriers, providing people with the supports they need, and environments for all children and families can prevent ACEs and help all children reach their full potential. Next, we will talk about the biopsychosocial spiritual model of addiction. This model takes into account that each person is an individual and are shaped by biological, psychological, social, and spiritual components. People with addiction can lose control over their actions. They crave and seek out drugs, alcohol, or other substances no matter what the cost, even at the risk of damaging friendships, hurting family, or losing jobs. What is it about addiction that makes people behave in such destructive ways, and why is it so hard to quit? We are going to look at each section to understand how it all comes together and may impact substance use and mental health issues. Biological. Addiction tends to run in families, and certain types of genes have been linked to different forms of addiction. But not all members of an affected family are necessarily prone to an addiction. As with heart disease or diabetes, there's no one gene that makes you vulnerable. When you're becoming addicted to a substance, drugs or alcohol can hijack the pleasure-reward centers in your brain and hook you into wanting more and more. Addiction can also send your emotional danger-sensing centers into overdrive, making you feel anxious and stressed when you're not using the drugs or alcohol. When this happens, people often use drugs or alcohol to keep from feeling bad, rather than for their pleasurable effects. Psychology. Psychological factors can strongly influence a person's thoughts, feelings, and behaviors. Some of the following psychological factors may influence substance use. Mental health issues. As mentioned previously, mental health issues like anxiety or depression can put someone at risk for substance use. Stress. Stressful life events like work-related stress, trauma, and poor coping strategies may impact the risk of addiction. Coping with thoughts and feelings. Individuals may turn to substance or behaviors to help them manage their emotions or a certain situation. Perhaps they feel frustration or anger and use substances to calm themselves down. Sociology and social factors. Factors that may influence addiction include socialization, social networks, social support, and social differences. Socialization refers to the process by which individuals learn the norms, values, and behaviors of their society. It influences the patterns of substance use and the opinion of addiction. Social networks play a key role in addiction. For example, individuals who are surrounded by peers who engage in substance use abuse are more likely to develop addiction themselves. On the other hand, strong social support from family, friends, or support groups can help individuals recover from addiction. Social differences also contribute to addiction. Research has shown that individuals from lower socioeconomic backgrounds may be more at risk to addiction due to factors such as limited access to resources, higher stress levels, and fewer opportunities for social flexibility. Additionally, marginalized groups may face social exclusion and discrimination, which can increase the risk of addiction. Spirituality. The spiritual aspect of biopsychosocial spiritual approach recognizes the importance of meaning, purpose, values, spiritual rituals and practices, and beliefs in a person's life. It encompasses religious or spiritual beliefs, existential concerns, and the search for transcendence or connection to something greater than oneself. Now that we have talked about risk and protective factors about addiction, we will learn about two important theories that we use at Shared Health, Mental Health, and Addiction. First, we will define and discuss the levels of involvement. The levels of involvement looks at addiction on a continuum. We will look at each stage now. Non-involvement, never gambled or used substances or chosen a non-involved lifestyle following involvement. Irregular involvement. Infrequent involvement usually confined to certain situations or occasions, little or no evidence of any harmful or adverse consequences. Regular involvement. Regularly occurring involvement where patterns are evident. Some evidence of adverse related consequences may be apparent. Harmful involvement. Demonstrates evidence of recurring adverse consequences. Continues involvement despite repeated problems in at least one life area. Dependent involvement. Both characteristics of harmful involvement, a physiological and/or psychological need for continued involvement, and some loss of control over his or her involvement. Traditional abstinence, ending the use of alcohol and other drugs after harmful or dependent involvement and struggling with this transition. Stabilized abstinence or recovery, abstaining from alcohol and other drugs after harmful or dependent involvement and being stable in this phase of recovery. Next, we will be discussing stages of change, another framework for addiction and determining motivation. Another tool used in initial screening and assessment is the stages of change model. The stage of change helps to understand not only the process involved in making changes, but also the activities individuals can engage in to make self-changes or to assist others to make changes. It has been widely accepted at addictions agencies throughout Canada as a practice model for service delivery. It does not look at necessarily why individuals have problems, but instead focuses on how people change. When changing a behavior, people usually go through the following stages. Pre-contemplation, where they are often ignoring or denying the problem. Contemplation, where they weigh the pros and cons of making a change. Preparation, where they decide what they'll do to make the change. Action, where they take steps toward the goal. Maintenance, where they stick with it for the long term. Relapse, where mistakes and setbacks happen, and people must decide whether to keep going. Understanding this process can help individuals prepare to take these steps, decide how to tackle them, and follow through on their goals. If a person isn't ready to stop using substances, what can they do to decrease the harms associated with their use? We will explore harm reduction in the next section. Harm reduction is used in our everyday lives when we wear sunblock, wear seatbelts, and follow to the speed limit. Simple, yet powerful examples of reduction tools that save lives. In the setting of drug use, harm reduction can be a misunderstood concept, often related to enabling drug use, but has strong evidence to the contrary. Abstinence does not need to be the end goal. An individual's goals might be simply to gain support, housing, or stability in other areas. Let's talk about the principles of harm reduction next. Harm reduction has a number of strategies that includes safer drug use, managed drug use, abstinence, meeting people who use drugs where they're at, and addressing conditions of use along with the use itself. There is value in every person, and they are allowed freedom of choice. Canada's low-risk drinking guidelines were published in January 2023 by the Canadian Centre on Substance Use and Addiction. These guidelines provide accurate and current information to help people make informed choices about their alcohol use and how to reduce the risk of alcohol-related harms. The guidelines are aimed at adults aged 25 to 65 who choose to drink. The risk of alcohol-related harms increased significantly after more than 2 standard drinks per week. This includes increasing the health risk of developing various types of cancer, heart disease, and stroke. Alcohol use also increases the risk of injury and violence. Some key points from the low-risk alcohol drinking guidelines include 0 drinks per week. Not drinking has benefits such as better health and better sleep. 2 standard drinks or less per week. You are likely to avoid alcohol-related harms for yourself or others at this level. 3 to 6 standard drinks per week. Your risk of developing several types of cancer, including breast and colon cancer, increases at this level. 7 standard drinks or more per week. Your risk of heart disease and stroke increases significantly at this level. Each additional standard drink greatly increases the risk of alcohol-related harms. When pregnant or trying to get pregnant, there is no safe amount of alcohol to use. When breastfeeding, not drinking alcohol is safest. No matter how much alcohol you choose to drink, decreasing the amount you drink will be better for your health. If you are interested in decreasing your alcohol use, a good start is to track how much you drink and set a weekly target. Some tips for sticking to your goal include alternating between alcoholic and alcohol-free drinks. Drink lots of water. Participate in activities you enjoy that don't include alcohol. Canada's low-risk cannabis use guidelines help to reduce the health harms associated with cannabis use. These guidelines include 10 harm reduction-based recommendations, including delay using cannabis as late as possible in life, ideally not before adulthood. Remember, your brain is still developing until age 25. Avoid using if you're pregnant, or if you or family members have a history of psychosis or substance use problems. Choose products with low THC and/or high CBD content. Use cannabis in ways that don't involve smoking, for example, vaping or consuming edibles. If you do smoke cannabis, don't inhale deeply and hold your breath. Stay away from synthetic cannabis products such as K2 or spice. Limit your use. Occasional use, such as 1 day per week or less, is better than regular use. Don't operate a vehicle or machinery while impaired by cannabis. Wait at least 6 hours after using. Remember that combining alcohol and cannabis makes you more impaired. By combining any of these risks, the more likely you are to harm your health. Not using cannabis at all is still the best way to protect your health, unless you use with medical recommendation. Treatment should always be provided in the form most comfortable for the individual to begin with, either in-house, community-based, group, individual counseling, virtual support, or mutual aid support groups. There is no one-size-fits-all approach when it comes to addiction treatment. It also needs to be noted that most programming for substance use recovery will also have a co-occurring lens to support individuals with a mental health disorder. We will be discussing these options next. A referral for more formal in-house treatment is appropriate for those whose needs warrant it. Someone engaging in very harmful use, or someone with a co-occurring mental health disorder. In-house treatment may be more disruptive to the individual on a short-term basis because they may need to make arrangements to keep their job at the same time, may have to give up their housing, and may be separated from their families. However, addiction will be disruptive on a long-term basis if not addressed. Community-based treatment may be offered during evenings or weekends, either in a group or individual setting. Community-based treatment allows the individual to practice harm reduction, coping, and refusal skills in their lives in real time. This allows the individual to reduce the harms and risks associated with use. This type of treatment is advised for individuals who may be harmfully involved in substances or have had harmful incidences due to their use. Virtual support groups and apps tracking sobriety have also become a viable option for individuals who may deal with anxiety or who don't have access to in-person support. A barrier to this type of treatment may include lack of access to technology. Mutual aid support groups have proven successful for folks who are exploring changes in their substance use. An example of this group is Alcoholics Anonymous. The benefits of mutual aid support groups is that they are offered free of charge and are available multiple times of day with no waiting lists. There are many agencies and organizations across the province to support individuals in making healthy changes to their involvement with substances or gambling. Some examples include Rapid Access to Addictions Medicine. The RAM Clinic is an easy-to-access walk-in clinic that adults 18+ can visit to get help for substance use without an appointment or formal referral. RAM clinics are drop-in clinics for people looking to get help with substance use and addictions. This includes people who want to try medical assistance to reduce or stop their substance use. They may experience frequent intoxication or overdose symptoms, as well as unpleasant withdrawal symptoms when attempting to reduce or stop their substance use. RAM clinics are also for people who may have substance-related health issues, such as hepatitis, pancreatitis, or infections, among others. Manitoba Addictions Helpline. Dealing with an alcohol, drug, or gambling problem can be difficult, and it's important to find the supports that are right for the individual. The Manitoba Addictions Helpline questionnaire helps narrow down which programs may fit each person's situation. You can also speak to a counselor when you call the helpline. It is always up to the individual whether to use the information that is given from the helpline. The service is free and confidential. 211 Manitoba. 211 Manitoba is the front door to community-based government, health, and social services designed to meet the needs of diverse populations across all different aspects of life. It is a free, confidential service available 24 hours a day, 7 days a week, in more than 150 languages, including 4 Indigenous languages. Crisis Response Center. The Crisis Response Center is open 24/7 in Winnipeg for adults experiencing a mental health crisis. Individuals may also have an overlapping substance use, addiction, or gambling issue. Upon arrival, our staff of mental health experts will help those in distress to resolve their crisis. Shared health, mental health, and addictions. Shared Health Mental Health and Addictions operates inpatient, outpatient, and support programs and is committed to providing accessible, responsive, and inclusive services for individuals experiencing mental health and substance use challenges. Using a provincially coordinated approach, the service works with partners in the community and regional health authorities to provide low-barrier, client-centered care for Manitobans that supports healthy behaviors, mental health, and well-being. Mental health and addictions programs are also available through your local health authority and organizations. The Mental Health and Wellness Resource Finder provides a number of mental health, wellness, and addictions supports and resources for you and those you care about. Resources provided are province-wide and also include youth and adolescent resources. Thank you for watching our session today. We encourage you to check out the other sessions in our series, including a session on gambling and a session on mental health. For further information on anything we discussed today, please visit the Shared Health Mental Health and Addictions Library at sharedhealthmb.ca.